Hello guys, this is Rebecca on Koba. Welcome back to my channel, my YouTube channel. And as usual, I tackle conditions. So today I'm going to be under cancer. We have one major cancer that is a blow to the nation and the world at large, and it has grown so fast since it was discovered. That is the cervical cancer that happens or occurs in women of reproductive age. To begin with, cancer is the growth of abnormal cells. Normally, the body is made up of cells. But when a cell grows, apart from the ones that are known or the ones that the body has, to form some curves or some they occur in forms of pimples. They are painless. Now that is cancer. Then the cervix is a part of the reproductive system that is mainly found in women. The difference between men and women is because of some features. The cervix is normally found in women. It is in line with the fallopian tubes, where after fertilization, once the sperms are released, also the female egg, which is called the ovum, they fertilize in a tube known as the fallopian tube. Then when they after 2 weeks, they move to the uterus to form the zygote, the embryo, the fetus, until now the baby forms, known as the fetus. So, during delivery, there is that process. After contractions, there is a process of movement of the fetus towards the vagina. So between the uterus and the vagina, there is a passage known as the cervix. So that is the area that I'm talking about, known as cervix, when abnormal cells grow to form cervical cancer. So, cervical cancer occurs in women of reproductive age. These are women between the ages of 15 to 49 years. And the government of Kenya has tried again to select a younger age, that is 10 years. Every girl child who gets the age of 10, they have an immunization that is called HPV vaccine, human papilloma virus vaccine. This girl child comes to the clinic or any government facility. Also, the private have been empowered, and they are given that injection on their right deltoid muscle here. It is given in 2 divided doses. The first one is when the girl child gets at 10, then 6 months apart, they repeat the same. This helps to prevent, you see, a child at 10 may not know anything about sexuality, the sexual life, or may not be even sexually active. So the government chose that age in order to prepare these girls. And, we have early maturers and late maturers, those who tend to know more things as they grow by age. They may be involved with multiple sexual partners. Also, maybe they might be faithful, but be involved with these older men who maybe, or their boys, have other sexual partners. So with the vaccine that is already injected at 10, when the girl reaches the age of 15 and maybe get sexually active, the vaccine acts as a prevention measure. It will help reduce chances of that girl child contracting the virus. It is unfortunate that this program began this year. It peaked in 2020. For those girls past 11 years and above, it's so unfortunate, but not very unfortunate, because we always have prevention programs, that is cervical cancer screening programs. Once anyone within the reproductive age visits the facility, that is a hospital setup, and requests for cervical cancer screening, the providers are able to do, and they are able to detect if one has cancer cells. If not, it's well and good, and they are told on ways in which to prevent the cancer. If someone has some questionable, because after the screening, a health provider is able to detect or note the deviation from the normal. If it is deviated, they are given counseling and referred for either cryotherapy or pap smear. That helps really define if it is now the cancer of the cervix, and the earlier it is detected, the earlier measures of prevention are implemented. If it is in the late stage, family counseling, teamwork from all departments, psychological, nutrition, medical, nursing, the clinical part of it. We also have occupational people come on board. Like, it's a multidisciplinary action that is taken, whereby everyone gets to handle the patient on their line of duty. So, cervical cancer is a major blow to Kenya, not Kenya alone, but also the whole world. Like, it affects, cases are found each year, and deaths have occurred. That's why the government and the nation at large saw it wise to help this girl child at a tender age of 10, before they become sexually active or before they get exposed to the world. They are given prevention so that we have a bright future and a long life for the girl child, our mothers. I know most of us, or the nation at large, has lost a lot of women to this disease, the cancer. So basically, that was about cervical cancer. In case anyone has a question, you can pose it out. Yes. Kindly subscribe to my channel. The notification bell, press it. Thank you and bye.